Tuberculosis, or TB, is a disease that spreads in the air. And there are close to 9 million people who got TB in 2012. 13% of them, over 1 million people, are people living with HIV. And the sad statistic is that of all the deaths of people living with HIV, the cause of death was TB in 1 in 4 cases, because TB preys on weak immune systems. 1.3 million people died from TB, weren't able to access treatment, meaning that many of these deaths could have been prevented, and these happen mostly in the developing world. But the good news is that TB is curable, but early diagnosis and treatment is essential. I had my first TB screening last year in the Philippines, and since then, my doctor and I decided that it was time that I started a course of preventive TB treatment. If you're living with HIV and trying to protect yourself from TB, this is one of the strategies that is recommended. So for me, and people like me, that means taking TB medication like this, once a day, every day for 6 months, on top of my ongoing HIV treatment. The Global Fund makes up 3/4 of the international investment for the fight against TB. In fact, the World Health Organization stated in its latest report that keeping the Global Fund fully funded was essential in maintaining the fragile progress that has been achieved so far in the fight against TB. So on behalf of the Here I Am campaign, I would like to thank all the governments and organizations who have pledged their support for the Global Fund this year. And also ask for your help to rally decision makers in ensuring that the Global Fund is fully funded this December. We're at a critical moment in the fight against HIV, tuberculosis, and malaria. And world leaders have an historic opportunity to invest in the lives of millions when they meet in Washington, D.C. this December 3. So join with me and all the Here I Am ambassadors in demanding a fully funded Global Fund now.